This virus has deceived us every step of the way. We have been behind this virus from the very beginning, and it still surprises us. We thought initially that it didn't affect children. We're now dealing with an issue that's very disturbing. We have about 100 cases of an inflammatory disease in young children that seems to be created by the COVID virus. And this is something that is just starting, and New York is leading the investigation of this situation. The symptoms of the children are analyzed to the Kawasaki disease or toxic shock-like syndrome, but it's an inflammation of the blood vessels and can affect the heart. We've lost 3 children, a 5-year-old boy, a 7-year-old boy, an 18-year-old girl. The ages of the children affected in these 100 cases is all across the board, as you can see, less than 1 year old, predominantly 5 to 14, but we lost a young lady at 18 years old, and we have some cases up to 21 years old. So this is a truly disturbing situation, and I know parents around the state and around the country are very concerned about this, and they should be. If we have this issue in New York, it's probably in other states, and probably hasn't been diagnosed yet in other states. Because again, these children don't present the usual COVID symptoms. They're not respiratory symptoms. And I think that's one of the reasons why people haven't found it yet. But they know what the symptoms are. If your child has the symptoms that they are saying are symptoms that should cause an alert, we need parents to be advised. We also have the State Department of Health that is telling hospitals and medical providers to prioritize testing for the COVID virus for any children that are demonstrating these symptoms.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.